Today, we are excited to welcome Alina Hernandez. Alina recently received a doctorate degree in occupational therapy from Howard University. She is currently a practicing occupational therapist at the Pediatric Development Center in Rockville, Maryland, and she also has experience working with the Foster and Adoptive Parent Advocacy Center and has presented with kinship caregivers. So we are just very excited to have Alina back to share her expertise on a very important topic. Thank you for joining, and we hope you learn from this presentation.
Like Angela was saying, my name is Alina. I'm currently a pediatric OT, and I wanted to kind of create this presentation because it felt like there was a lot of need for foster, kinship, adoptive parents, even birth parents too, to work on how to manage and handle challenging emotions and how family togetherness and bonding can kind of help with those difficult emotions that we kind of see in our kids sometimes. Oops, let me see if I can. There we go. So right now, I'm currently, like I said, a pediatric OT at a place called the Pediatric Development Center. So I work with treating a lot of children who have autism spectrum disorder, oppositional defiance disorder, sensory processing difficulties, just emotional challenges, and other developmental challenges that you may have heard of. I completed my doctoral capstone program. For occupational therapy. If you do the doctoral program, you need to create a presentation. So I created a presentation about how to help our youth aging out of foster care, kinship care, prepare themselves better for adulthood. And I went ahead and presented this at a organization called the Foster and Adoptive Parent Advocacy Center in Washington, D.C. In 2024 to a group of youth. And then I presented a similar presentation to KCC, I think about a year ago as well, just talking about strategies and what to do with those kind of children who are 14 to 18, aging out, wanting to be more independent and on their own, providing them with those skills, be able to live more independently and with more confidence. So some of my current focuses is on co-regulation. Has anyone heard of that term before, co-regulation? Okay, I'm seeing some shaking heads, no. So co-regulation, I'll explain it more in detail in a minute, but basically it's keeping ourselves calm in the moment to help our kids be calm. So that's what my current focus is on in the job that I'm working with, helping families be able to maintain their own emotions to help their children regulate their emotions. I also assist families, kind of my niche area is assisting children who have difficulties with feeding. A lot of that is kind of sensory difficulties. They feel, nervous trying new things, new foods especially, and food is one thing that they have a sense of control over. So helping them kind of overcome those fears is kind of my area that I've been working on as well. So the themes for today, we're going to talk about co-regulation, the polyvagal theory, and then finally some strategies that can help us maintain our emotions and help our kids maintain their own. So I want to just highlight the importance of family togetherness and the impact that has on emotional, social, and mental well-being of our children and teens. Again, I am not a parent. I'm coming at this from an OT perspective, so I am more than open to hearing all the tips that you have for me to help kind of frame it a little more towards what you guys deal with on a daily basis. So again, what is co-regulation? So it's the process in which one person relies on the supportive presence of another. That can be through connection, strategies, and calming techniques to help regulate their emotions, behaviors, and manage their internal or external stress. So in order to co-regulate, us as the adults must first ensure that our own regulation is in check. So kind of being able to fill up our own cups first before filling up those of our kids. The next slide will kind of help us talk about the science behind why co-regulation is important and why it's needed to help our kids stay calm. So this next slide is called the polyvagal theory. So it's kind of a big fancy word, but don't get too freaked out. So this was a theory proposed by Dr. Stephen Porges, and he discussed how our autonomic nervous system it helps us respond to perceived safety and threat and how that impacts our behavior and our mental health. So it also highlights the importance of our vagus nerve, which is a nerve in our brain, kind of deep inside, that is a key component of this autonomic nervous system, the way that our body kind of reacts to being scared, being nervous, or being happy. And this can help us regulate our social engagement, our fear responses, and our stress. So the autonomic nervous system is split into two parts. So we have the parasympathetic nervous system and the sympathetic nervous system. So the first one is the parasympathetic nervous system. This helps our body kind of rest and relax. So when our body is kind of in a slow, calm, and relaxed state, we are more open to connection, engagement. We're able to feel calm, rest, fall asleep, digest our food. The opposite end, the sympathetic nervous system, this is kind of like our wake up system. This can kind of look like when you have your heart is beating very fast, your blood pressure is increasing, your muscles are getting very, very tight. That is your sympathetic nervous system activating. Let's kind of dive into how that all relates to managing our emotions. So if you look at this first circle here, we have the blue relax circle. So this is our parasympathetic nervous system, our calming, resting, and relaxed state. So it looks like, we have a normal heart rate, our muscles are calm, we're not tensed up and anxious. When we're in this state, us or our kids, we are open and ready for meaningful connection. We feel more safe and we are more oriented to the environment. We kind of know what's going on around us. We're not kind of focused on our stress and our internal factors. So in this state, that our children and our bodies, they are ready and relaxed to open and engage in conversations. This is a great time to talk to your child about both positive and negative emotions when they're in this state. It's often hard for children to label their emotions, especially our young children. So what I try to do often in my work is trying to label what I see the child's body doing. So for example, if I see, the child is feeling upset and I say, "Oh, are you feeling upset?" And they say, "No, no, 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 no." I can tell them, "Oh, well, it looks like our body's really scrunched up. It looks like we are turning away from me. It looks like we are not ready to talk. We're starting to cry. This is what I'm seeing. That makes me think that you're feeling sad." We can do the same thing talking about feelings of happiness and emotions too. So it's good to practice this for both negative and positive emotions. So when a child is in a happy state, you can say, "Oh, it looks like you're happy. You know how I know that? Because you are smiling, you are giggling, you are talking to me. We are having a great conversation. You're giving me some love." That's a great way to kind of show those two different sides of the spectrum here. More for our older kids, you could say, "I noticed yesterday, you were very quiet. You weren't looking at me when you were talking. This makes me think that you're upset about something. Is there something on your mind?" So opening that door to conversation can be easier on the child if the adult kind of initiates that and opens the door rather than them. Often kids don't know when is the best time to talk to an adult about their problems, and they're sometimes just waiting for us to come to them to say, "Hey, what is going on?" If you as the parent can have this conversation and start it when they are in this calm, relaxed blue circle here, it might increase their chance of opening up to you. Any questions about this relaxed state before we jump to the non-relaxed states?
Rachel did have a question in the chat. Do you have a good way to explain the fast heartbeat to developmentally delayed kids?
Yes. So oftentimes I can relate the fast heart rate to kind of like a fast engine speed of a train or a car, kind of like their preferred, toy. So a lot of times I say, "Is your engine running really fast right now?" Or, showing them a video of a train going very, very fast. And, "Oh, I could barely see the train going by me. It was going so fast. It could go off the rails. It could fall. It could get hurt." And then showing them a video of a train going really, really slow. Looks like this train is tired, and kind of relating that to what you're seeing. And then a train going at the right speed. This train is moving just right. It looks like they are ready to arrive at the station and pick up their passengers. Using kind of metaphors like that often helps kids kind of make those connections. If they are still, maybe they're nonverbal, they're not understanding that aspect too, giving them kind of like a model and just repeating kind of over and over, like heart is beating fast, and kind of showing them to take deep breaths. It won't always work, but the more you kind of model that behavior, the more likely they're going to pick it up and kind of do it on their own over time. For a lot of times, this isn't like an overnight shift for kids. It takes, weeks on weeks of practicing and having the parent model deep breathing or repeating the phrase, train's moving fast, let's slow our train down, to try to help them make that connection, if that makes sense. Perfect.
Very helpful. Thank you.
Good, good. So now we'll move on to the more this mobilize, this fight or flight state. So this is our yellow circle right here. This state is characterized by the increase in heart rate, like we were just talking about, that high blood pressure, that increased muscles. We are really, really, really tight. This is, our children are feeling anxious, stressed, fearful. This is not the best time to be talking to your child about their emotions. So if you see them kind of, we hear them yelling, screaming, having, a really tough time, trying to sit them down and saying, you're not feeling safe right now, or you're not feeling happy right now, they're not going to be able to understand that at this time. Their brain is kind of shutting down that conversation mode and kind of in this fight or flight mode. So they really can't hear you or process what you're saying when they're in this state. So trying to kind of communicate your concerns and your needs for them in that moment is not the best time. So it's important to try to work on calming them down first and then getting them into that relaxed blue state to talk about these emotions. And I'll talk about strategies on how to do that in the next couple slides. So this may be a time for, if we have teenagers, where they might be saying harsh things that we might find disrespectful, and try to place blame on the adult for their feelings. And as hard as it is, we have to try our best to not take these things personally and realize that this child is in the fight or flight state, where their nervous system is on overload and they're trying to protect their own physical and mental well-being. So they're kind of pushing any of their inner thoughts and emotions on anyone and everything that they see on the outside, whether that be verbally or physically. As we know, a lot of children who are in kinship care may have experienced some trauma, and they might experience these fight or flight reactions for what we may think is the smallest problem. We say, okay, it's time to clean up your toys, we're all done for now. They might take that as, oh, I'm done with my toys forever, I can't play with them again, grandma hates me for doing this, who knows what's kind of going on in their mind, and they automatically go to that fight or flight state of no, throwing toys, getting upset, not being able to calm themselves down. So again, we'll kind of discuss more on how to manage these emotions later on. But just want to highlight that keeping a calm and open presence when you are noticing your child in this state is very, very important. So when they realize that us as the parents aren't trying to fight back or agitate the situation, their nervous system over time will realize they don't need to be in this fight or flight state just to kind of have a conversation or to kind of express their needs to us. And they'll kind of begin to regulate their emotions in their bodies on their own over time. So that is the co-regulation piece, us staying calm when our children are getting very, very worked up. So the more that we practice that co-regulation with our children, the less behaviors we'll see and the more feelings of safety that we can create in them. This last one is the immobilized state. So this is, we are shut down, checked out, we feel very overwhelmed at the moment. This can be looking like, we have very low heart rate, low energy. We may be feeling a little bit depressed, hopeless. We see this maybe in our older kids. Also, when they're feeling unsafe, that's what they're feeling. If the child is feeling safe and has these symptoms, they just kind of might be, daydreaming, kind of in their own world, not focusing on what's going on. So kind of getting them back into our reality is also important. So when children are in this state, it's important to remind them that they are safe, and using some strategies such as offering them space, a hug if they're receptive, or other calming strategies to help their nervous system come back and into that relaxed part of the parasympathetic nervous system and realize that they are calm and okay and safe. So next slide, we're going to go ahead and talk about when and how to talk about these emotions with kids. So again, not discussing emotions when we as parents feel overwhelmed. So if we see ourselves getting worked up and we're like, you know what, I'm about to lose it myself, let's take a step back and think, okay, this is not the best time to talk to my child about being calm when I myself am not calm. This happens to me a lot too in my job. Sometimes I get very overwhelmed and I say, you know what, I'll take a step back, take a deep breath and say, okay, I need to make sure that I am relaxed and calm first before I try to talk to this child about how to get themselves into a calm state, if that makes sense. So when the child is calm, open to connections, and settled in that blue circle is when we can have that conversation. This can be when a child is engaging in preferred activity, playing with like a fun toy during a family meal time. Maybe try not to do it when they're watching like a very fun show, because they might not listen to what you're saying and they might be more interested in this show. So a time where they're kind of playing with the toy or sitting down with you at a table or going for a walk is a great time to kind of discuss these hard emotions. Next, like I said before, is when we as the parent are feeling calm ourselves. So always doing a quick check on ourselves. Is my tone of voice raised? Is my body language kind of really aggressive and defensive? We kind of want to make sure that we're not coming at them and like pointing our finger and getting very big over them, coming down to their level. If they're a kid, they're a teenager, maybe sitting down on their bed with them and kind of coming from at the same level as them will kind of make them feel more safe. Of course, if the child is demonstrating, any unsafe behaviors, if we are throwing toys, kicking, hitting, punching, of course, we need to make sure we keep them safe and ourselves safe, taking a step back, removing any objects, making sure that there's like soft pillows around that they can kind of fall on if they're kind of throwing their bodies around like some of our young kids do. During that time, we can still be kind of telling a child, that, we love them, we care for them. I want to talk to you once you're calm. Even though they're not going to be hearing that in the moment, it's still good to kind of verbalize that so they maybe in the back of their mind might pick it up. And honestly, for ourselves too, to realize, I love this child, he's having a hard time. In a minute, we'll be able to kind of calm down and talk about what we're feeling. Another time to bring up kind of questions regarding emotions is if the child brings it up themselves. So the child might say, why do I feel like this? Or, I feel so angry all the time, or I feel like my body is really, really tight all the time. Are you mad at me? Anytime the child initiates the conversation, it's great for us as the parents or adults to kind of step in and say, hey, okay, I'm open and ready for that conversation as well, and kind of explaining, well, I was a little upset with you when you threw your trains down the stairs. That did make me feel a little bit sad. Maybe next time you can tell me that you were done with the trains or wanted to do something else rather than, doing something that was a little bit unsafe. So kind of always explaining to them, be honest, say, yeah, that made me upset, and kind of giving them an alternative of what to do next time instead to kind of resolve that situation. The times when we do not want to have the conversation with our kids is when they're in that red or yellow circle. They do not respond well when they're in that fight or flight state. They are trying to fight or flee. They are mentally unable to kind of process what you're saying to them. So you're probably going to end up repeating yourselves again when they're in that calm state. So just waiting until they are ready for that conversation is really the best time. Any questions on when and how to discuss hard emotions with kids of any ages? So I'll kind of go ahead and continue, but feel free again to stop me anytime if you have a question, if I'm moving too fast, if this is kind of a lot and overwhelming. I know when I was first trying to learning about it, I was like, how am I going to be able to manage my emotions at the same time as a child having a huge meltdown? Like, I'm obviously going to be getting worked up too. And to know in ourselves it's not always realistic to have every time be perfect. There are going to be times where we do get upset and we yell back, and there are going to be times where the strategies that we talk about today aren't going to work, and that is 100% okay. This is just strategies and techniques and stuff to use. Every child, every family is different, so what may work one day, next day will not work at all, but then 2 weeks from now they might only use that one tool. So it's kind of a trial and error process that we can kind of all go through together. Okay, the next is just a little bit of research about this polyvagal theory, co-regulation, and kind of this background information about why this is important and where it all comes from. So again, we have that vagus nerve in the back of our head that regulates all of our body functions, and that is kind of where we get the polyvagal theory from. It's all interconnected. The next we have here is an article from this journal, which talks about how early family involvement and bonding kind of resulted in less problematic behavior in young kids, which I thought was very interesting. So when kids felt really safe and secure and bonded with at home when they were really young, they would grow up with a little bit less kind of behaviors, a little bit less strong emotions. So I think they looked at like 30 or so families and kids and realized that, once we had families involved at an early age, it was able to show that there was less of these aggressive behaviors. Since they are at such a young age, they kind of learned at this time that acting out will not cause a harsh reaction, and that it will be treated with understanding and sometimes consequences, yes, but never kind of aggression back, if that makes sense. So we know that children are very often trying to push the boundaries, and oftentimes they want someone to kind of match their level of stress to feel like their reactions and their impulses are validated, right? So we want to show them that, we're not going to really match their levels, and we'll continue to kind of be that safe space for them. And over time, the more we are that safe space for them, the more their bodies will realize, okay, even though I yell at grandma, she's not yelling back at me. So maybe my body can kind of realize that grandma is a safe person to talk to. I'm okay, I'm safe. I don't need to talk to her in that way because I won't be matched to the same level as her. And then the last one here is a book called The Whole Brain Child. So this kind of talks about 12 different practical strategies to help children integrate different parts of their brain so they can become more balanced, resilient, emotionally healthy. I have a handout actually that I can maybe send Angela to share at the end of the presentation about the 12 different strategies that we can use with our kids to help them be more emotionally balanced and ready and stable. So I'll go through them kind of quickly. Any questions currently? I don't think I see any. Okay, perfect.
I love how you've brought all of these theories and research together.
Yeah, just to kind of show that I'm not just pulling this out of thin air. There are some people that kind of think this works sometimes.
Right.
So kind of just to break it down, we talked about a lot. So children who spend more quality time with their parents and caregivers are less likely to kind of have these behavior issues within family and at school and in the community. They will feel a sense of security at home, which will activate, again, that vagus nerve, stimulating a very calm heart rate and hopefully, in turn, some positive emotions. Oftentimes, children with a history of chronic stress or trauma have a highly activated autonomic nervous system. So their body is constantly sending out signals of danger when they're actually safe. Like I said before, some little problem might set off their fight or flight that we might not realize would do that for a child. Or, in one child it would, in another it wouldn't. So in turn, more safe quality time and an increased sense of security can lead to a decreased fight or flight response activation. Oops. So here are some strategies. So as an OT, a lot of what I do is educate parents on the importance of providing sensory strategies to regulate our children. Giving them what we call proprioceptive input or deep pressure input provides, like I said, that calming sensation to the nerves under our skin, which sends a signal to our brain that we are safe. So a lot of deep pressure strategies that I use, a lot of times for deep pressure, what I recommend is hugs, is squeezing a pillow. Something interesting is pushing or pulling on heavy items or pushing up against a wall. A lot of times I'll have my kids, if they're sitting at a desk, kind of pushing themselves up from their desk to provide some deep pressure input, giving themselves some hugs around their body, and again, giving themselves that deep hand input pressure. A lot of times when kids are seeking that input, it's through their hands, like Rachel was saying. We are hitting, we are trying to get that out through our hands. So giving them pressure and strategies and input to that one body part that is acting out can hopefully help. Also, weighted vests or weighted blankets. Has anyone ever used those before with their kids, with themselves, honestly? Yeah, Rachel, yeah. Do you think that kind of helps you or your kids and provide, is it a calming sensation or do you get a little worked up? Yep. It definitely depends on the kids. Some kids got it. Yep. So Rachel found out that does not work for her. That strategy is not one she's going to be using in the future. So for Rachel, I can recommend other strategies for you to do. We can work on like visual sensory stimulation. We can work on tactile stimulation, touching like a fun squishy pillow, squeezing a stress ball. That can work for maybe your child if the kind of weighted and deep pressure doesn't. I wish I had a swing in my house. We have so many swings here, and a lot of times my kids who come here are worked up. They're coming in crying. They are upset about, mom or a toy. I get them on a swing. I dim the lights. I put on some fun, colorful blinking lights. All of a sudden, the children are calm. They are relaxed. They're taking deep breaths. They're laughing and they're smiling, and they're like, "Oh, we're ready to play now?" I was like, "Oh, okay." So what you're describing is kind of that vestibular input. So getting those swinging, the back and forth. If it's kind of a younger child, kind of like almost rocking a baby to sleep, is that same thing that a swing is giving the child. And then for visually, a lot of times what I do is kind of show them any of those ocean life videos so I think we have some vacuuming going on if you hear any background noise. To kind of watch, looking at a fish tank, all those things are so visually calming for kids. Something else that I do a lot with my kids is straw blowing games, which is seems a little bit silly, but I'll have them take a straw and I'll get like a cotton ball or a pom-pom, and I'll have them try to blow the pom-pom or the cotton ball to a certain point on the table. So that is kind of inadvertently working on taking deep breaths and kind of managing our breath flow. So in a fun way, we can say, "Oh, can you get to the first line?" They take a breath. "Oh, second line." So they're kind of practicing that deep breaths without us saying, "Take a deep breath." A lot of times that triggers kids to even get more upset. That can be a nice little trick to use if you want them to kind of calm down and take a deep breath.
For my 5-year-old, I let her color. It actually soothes her.
Good.
Oh, there we go. Perfect.
Yes, exactly. Yes, more strategies for calming down and just for quality time. Coloring, a lot of things, it's very calming for kids. Something they can focus on. They feel relaxed. They feel in charge of what they're doing, building that confidence and autonomy for them. Family meal times, family movie nights are often good. Even just engaging in weekly chores together, having grandma, grandpa, and the child all involved in doing the dishes together so they feel like they're one family unit rather than just having the kids or us as the parents doing it on our own. Again, drawing, family game time, or taking walks. A lot of times for our teens, it's kind of finding that niche area that our teens are interested in. So try to, get into what they're interested in, kind of see their interests, what their likes are, and try to build on that. And, maybe one day a week, kind of dive into their interests a little bit. And that is all I have for you today. Just to kind of wrap it up, keeping calm in these times of stress is one of the hardest things to do. So oftentimes it's important to, as the adult, take a step back, make sure our child is physically safe and secure. Maybe we can leave the room for a minute, take 5 minutes, engage in deep breathing on ourselves, listen to a calming song for a minute. All these strategies that I mentioned earlier for kids can also work on ourselves. There are so many times where I'm with a child, I need to like take a step back and just make sure that I am calm first. And remind myself that this child is still learning on how to be calm, and it's my job as the adult to kind of help with that. So the more we practice and prepare for these in the moment scenarios by engaging in these strategies that I talked about before throughout the weeks, throughout the times where we are feeling calm and safe, the more that can help prepare us for being in that calm state. So oftentimes physical activity or moving our body is a great way to kind of release those endorphins, increase our overall mood and our affect, and helps us activate that vagus nerve. Even just a quick, like we're saying, stretching, jumping jacks, a quick thing to kind of move our body can kind of help regulate us and get us back into that calm and relaxed state. So I wanted to ask you all, what are your kind of go-to strategies for quality family time that you have realized works for your kids at home? And I'll